Welcome to the Afro Health Diaries podcast, where we bust health myths, explore common conditions, and spotlight doctors, innovators, and health tech pioneers across Africa and the diaspora. It's all about good health, how to get it, how to keep it, and how to share it. Welcome to the first episode of the Afro Health podcast. My name is Dr. Jacqueline Bamfo, and I'm with Dr. Mark Nyanzu, and we're both UK doctors. I'm an obstetrician, he's a neurosurgeon, and we are part of the African diaspora, in particular the Ghanaian diaspora.
Yeah.
We are interested in healthcare in Africa.
Interested in lots of things, but specifically we are focused on Africa health, Ghana and West Africa for that matter. We want to look at the current situations, what people are up to, especially with the return of diasporic health practitioners wanting to give back to their various African countries. And we think it's a special times we are in, and we would like to delve into these.
Great. I'll tell you a little bit about the podcast. It's the Afro Health Diaries podcast. We are here to explore common issues concerning healthcare in Africa. We will be interviewing a whole group and a very interesting mix of doctors that are interested in lots of different things. Many doctors will have side hustles or side gigs that overall have a focus on health. But we want to talk about their journeys. We want to explore what made them do what they are doing. And also we want to inspire the next generation of doctors to use their medical knowledge to be able to affect change. That's change in society, change in health, change in policy. So if you're interested in any of those, then please listen to this podcast, Afro Health Diaries podcast. Overall, we're going to be talking about how to get good health, how to keep it, and how to share it using a variety of means. So today we're going to be talking about something that's really, really interesting, and that is the brain drain. You know that we always talk about people leaving Africa, coming over to Western countries, which means that the doctors and the health systems in particular, we're talking about Ghana, end up having fewer doctors to help to sustain the healthcare system. So we want to talk about something that we've noticed, and it seems to be like a reversal of this. So diaspora doctors are going back to West Africa, and we want to talk about why this is happening and what is this signaling. So I'm going to start with Mark first. Maybe you can talk a little bit about yourself, but also, we can get into this topic. And the first question I'm going to ask you is, what are we seeing and why are we seeing it?
Yeah, to start off, my name is Dr. Mark Nyanzu, but because I'm in the surgery field, we like to be called Misters. It's something I learned was I came to the United Kingdom. It's quite special in its way that we're called Master, for that matter. But yes, Dr. Mark Nyanzu, I'm a neurosurgeon based here in the United Kingdom. As my colleague Jacqueline rightly said, we're more interested in Afro and diasporan health. Yeah, bringing it back to what we want to talk about, which is the brain gain or the brain drain. I like to see it more of a brain gain now rather than drain. I think we've passed that stage. Um, a lot of reasons, really. Would take a lot of time to digest this properly, but we all agree that there is that momentum, and that's the time we are in now. Probably the work is being made easy by our European counterparts with a lot of migration issues here and there with practices. So people are finding that, returning home or serving home probably serve a better cause rather than staying abroad. And there's a high sense of also patriotism. Again, just to lay things out there that is driving a lot of these things. And then probably the third thing is that conditions are becoming relatively better at home. I don't want to use the word the grass is greener. I think, those are things of the past, and it's getting greener almost everywhere. Uh, and Africa is no exception. So here we are.
I mean, one of the things that is really I found really fascinating was that did you know that there are more than 55,000 African doctors, which this is estimated to be working in the world's richest countries? Did you know that, Mark?
Yeah, I'm not sure I know the exact number, but I'm not really surprised. I mean, we both work in the NHS, and when you turn left and right, I mean, the people that you see most are foreigners, and it's crazy because
This does have an impact on different healthcare systems. And we've been working, doing some work through our charity that we work
yeah,
with. We know that there is definitely a real need to strengthen healthcare systems in many countries, including
um,
Ghana. Yes, you've elaborated that maybe the changes and the rules, for example, the new prioritization bill, for example, things like that will definitely make a change. But is there anything else that's driving that change in terms, is it like quality of life?
yeah.
Well,
There's a lot, Jacqueline. I mean, we're proud to the prioritization bill, for example. I mean, I don't want to sell myself out there, but I'm keen to go back home, you know, proud to even the prioritization bill. So, and what was driving that is more of the fact that we have very limited expert, specialist doctors in various African countries. Yeah, you can name them from country to country, from Namibia, Ghana, Gambia. This is 21st century, and if you look at the numbers, it's not great, and the days of malaria and all these cholera and whatnot, diseases are becoming a thing of the past because science has advanced, isn't there's vaccination for a lot of these diseases. But now non-communicable diseases are taking center stage. And if you think about it, these conditions need to be treated by experts and specialists in the field. So if my uncle or my mother had a head injury, for example, in Ghana, somewhere in the remotest of places, they wouldn't have any resurgent to look after them. Yeah. So that in itself, it's not great, and if we fall on the experiences we've gained in these supposedly, first world countries, they have villages as well, right? They have peripherals. Everything is not London, everything is not Birmingham, yeah, but no matter how far you go, you still have your expert or specialist care. You understand? So how do we sort of contribute?
so is
It's
this driven a little bit morally? Like, it's really hard to see it's the haves and the have nots when you have people that have access to really good healthcare, and then you also work in a system where you know that there's options available, but that option isn't spread. Is there a little bit of a moral, like there's an internal moral compass to want to do a little bit more?
I mean, yeah, I don't know about moral, yeah, I pray to God, I and all of those stuff, but um it's where you serve the most, I think. And I'm probably not the only one who's thinking in this sort of lines, where you find that you can do them because it's medicine, right? And there's the popular saying of do no harm, our job is to provide care. Yes, we're providing care here as well, but if I take myself out of the United Kingdom, for example, does it affect the system really? I'm not sure. you know, I'm not sure. You understand? But for every specialist or expert or a doctor, for that matter, no matter how low you are in your ranking, that leaves a region in Ghana. It affects a patient. There's been recent debate and issues concerning people who are being posted to remote places of low resources in Ghana, and some of those doctors are not taking those posts. Yeah, for every post, for example, in those remotest of places that is not taken, somebody is affected in terms of health wise. A child will be delivered that will probably not happen in the best of place or the best person.
Mhm.
So it's the knock-on effect is large. Yeah. So we are lucky to be in the field we are in, that we are, well, how one of my senior colleagues says that, we are, what's the word I'm looking for? If we are needed in Middle East, we'll be there. If we are needed in Ghana, we will be there. If we are needed wherever, so we are ambassadors to that extent. The skills that we have goes very far. And this week I learned something new.
Okay.
Someone We all born with a talent. If you are not born with one, you get a talent as you go along the way. Now, what you do with that talent, it's very important. If you put it to good use, great. If not, then that's just sad.
Hmm. You sound like you're preaching, Mark.
I'm sorry, but I could probably be a pastor at some point.
Are
Yeah.
there examples that you can give of just to show what is happening? In what ways are the diaspora contributing to healthcare in Ghana and other African countries?
A lot is happened. I mean, and a lot is happening on a small scale, on a large scale. Yeah, there have been charity organizations that have taken their practice back home, and they're giving excellent care to people. At subsidized rate, some of them at free rate. I can talk of people like Focus, which is an orthopedic center, does all this scoliosis correction. These are
Wow.
expensive procedures, yeah, but they do them to people at subsidized rate. Obviously, some people have to pay, yeah, and they have different ways to stratify who gets free care or not, which is great. Other infertility centers, have come up. All of these started as charity, and the same. And even in my own field, I've seen people who have returned home, especially in Nigeria, and they're providing lots of good expert, world class, uh, you know, surgery to patients, which were not there before. And you see, human resource is so important, yeah. And certain countries have maximized this sort of thing to their advantage. You talk of countries like China that have large numbers, yeah. Before China opened up, a lot of their people were sent abroad to US, UK to go study and build themselves up, and they all returned home. Then by the time they opened up, the country was ready to what to blow. That's resources, the resources, the human resources that are there are very important to be put to use. Um, I like to say something though. The unfortunate thing in this, brain gain or brain return for that matter is that we find that a lot of us are getting more concentrated still in the big cities,
Mhm.
in the capital cities. Yeah. And that I think is what has slowed a lot of progress. Yeah. If you think about it, not many
Mhm.
returnees go to the peripherals.
Mhm.
Yeah. And there should be a concerted effort to get that in place because by and large, the reason, for example, my first statement, what I said, the reason I'm keen on returning home is because I want to what? Help the people who are not getting what help. But if we all keep going to the capital cities, those who are more affected, who are outside of those large cities still remain.
But I think moving into outside also relies so much on infrastructure, transport, accommodation, schools. It all goes together. If you look at the way urbanization happened, or the development of transport links, whenever there are good transport links, then there's a drive for people to move into certain areas. So as well as the healthcare facilities developing in those areas, the local infrastructure has to also develop in that area to motivate people to move into those areas. But of course, that doesn't I'm not saying that, people still that are living there still need good healthcare. If you're a diasporan, okay, and you're listening to this and you're thinking that, you want to go back, what are the important steps to take? So, for example, licensing, where would you go? What would you do?
Yeah, things are a lot easier now. Yeah, in the past it was very difficult. There were a lot of blocks, social blocks, exam blocks, and other issues, personal blocks that made it almost impossible for people to want to return home to provide more support, etc. But now I think government, leaders and policymakers are tapping into the momentum we are in. They've realized that. I think I'll probably give a thumbs up to our former president Akufo-Addo, who started this return. I think return home or something. I
The
think
year of
it's
the return.
the year of return it's something special, and I think the impact that had is great because see, I studied in China, yeah, Jacqueline, and every time I was not going home a lot. I think my first time I went home was after maybe 3 years. Then it took me a very long time. Then I returned home. Then when I returned home, I was amazed by how much development and infrastructure is going on. So that return home does impact people because you get a different perspective. Yeah. Now back to your question. You government and policymakers are tapping into this momentum. So there are things that have been put in place now to help people to return more. I mean, between me and you, we are both members of the Ghana Doctors and Dentists Association. We are executives,
Yeah.
and we've established a good MOU between our Medical and Dental Council to allow for ease into returning home, where your licensing can be sorted if you have obviously good intentions to return home to do something. And it doesn't matter where, whether it's in Accra, whether it's Elebo, my little village, whether it's in the Fianconta, wherever it is that you want to do so. The paths are well laid out. It's cleared. So you don't exams and all those things are sort of out of the way. Um, and these are things that people are doing. And other things like the Ghana Health Service, collaborating and being in touch with more diasporan organizations are making it relatively easy. And not to say the least, I think our colleagues who are at home are more open arms now to allow Ghanaians and for that matter, African um, descent or connections to come home because sharing of knowledge practices it's something that we are all embracing now. And we are not, I think in the past it was more of competition, being seen as competitors rather than supporters or collaborators. And I think that sort of thinking is beginning to sink in, and it's made things a lot easier.
So essentially, it's easier to get licensing and prove your credentials than it was 5, 10 years ago.
Absolutely, 100%, a lot easier. I mean, I can speak that for Ghana, and I have done some outreach and some benevolent work in other African countries. I recently went to Rwanda, for example, and their licensing authorities made life easier. Within a couple of days, they were able to provide licenses, for me to do some work there. So I think a lot of countries are jumping on this paradigm, and like I said, I think it will continue. Um, I don't want to, I don't want to say the world, the developed countries should they be worried? I'm not sure, but I think a lot of people would be, and it is not just Ghana. I think it will probably be global within a very short time. Uh, Everybody would want to be
It's
giving
just
and
a concept.
supporting, yeah,
Yeah.
where it come from. Because if the need is there, then it doesn't sort of make sense. You see what I mean?
Hmm.
Obviously, financial reasons, etc. All of those things played a role, but like we said, things are getting better, if not better already, wherever
But
we
let's
walk.
let's let's talk about money, okay? Let's talk about money. No, doctors don't like to talk about money, but you need to pay your bills, okay?
Agree.
So,
I
what
agree.
about salary? Let's say you want to move back, you want to go into a practice.
Yeah.
You have to think about where you're going to live. You have to think about the
Right.
school your kids are going to go to.
Yeah.
If you have 3 kids, like, logistically, how are you going to move them back, the whole family, you, your partner, the kids? schools, everything. Realistically, how's that going to work?
I don't. this this is you've opened a bag of worms, I would say, but and there's no straight answer to this question because everything is becoming you're making them up as you go, isn't it?
Yeah.
You're making some of the decisions as you go. So I don't think there's really a clear cut. But one thing is for certain, with the advent of AI and telemedicine, things are becoming relatively easier, yeah? So you don't necessarily have to move your whole container, your whole baggage, your whole hand luggage, including your kids, your partner, etc., in the first instance.
My
Yeah.
kids are my Gucci bags. That's what I call them. They're my designer bags.
100%. Yeah, makes the two of us. Yeah. And the kids, have a different mind. They can't relate to the things that we are talking about, isn't it? They have their own lives to live. We're all in different stages of our lives. Yeah. But because AI is playing a role now, some of the supposedly in quote moving can be done virtually or remotely. Yeah.
Like
So
telehealth clinics.
like telehealth clinics, you understand? I can speak for the surgical side of things. You can do your consultation, some of them, there's something called even NHS we use it. There's something called what's it called? I don't know, I've forgotten the word, but it's like do your clinic wherever you go, like you could be anywhere and say that again.
Remote clinics.
Remote clinics. So there's a fancy,
Virtual
a nice word for it. It just skipped me now. But essentially, you could be talking to your patients. You can examine them. You can do your physical examination, etc. You take your history, and then you get the tests and investigations, all of them done. Images can be reviewed nicely on your computer wherever you go. I mean, the radiologists are doing them. They are reporting from.
Radiology reporting is a really good way. That's
Exactly.
really,
You see what I mean? So all of these are helping to make things easier. So by and large, you could do a lot of your activities wherever you are. Then in stages and in steps, you make your relocation. If there's one thing that I want to emphasize is that returning home would never be a regret, I think. As far as the money aspect goes, you see, the salaries can't be matched. That's for sure. Yeah. But when you think about it also, even the salaries in England, so much tax to be paid, so many things to be paid. Yeah. And sometimes we know it's all in our mind that the salary is large here, but sometimes it's actually not. You understand? You can do your private work and all of those stuff to make the bucks, and all of that. But I don't want to say the word, but some of your colleagues, even at home, could be doing better than you. No, we don't like to accept the truth, but if you put your mind on the ground, see, being a doctor in England is great, but it's not very great.
I think it's relative, isn't it? I think with most things, it's the pros and the cons.
Correct.
And I think that it all depends on the stage of career. I think regarding many of the diasporan doctors, as you said, it's also about sharing the knowledge and capacity building, because it's there's so many ways in which we live in a global world
Correct.
now. When I started university and I lived away from home and I would go and call home, I'd have to go to the telephone box. I started the days where we didn't have any mobile phones. I entered into university when you would have to go and stand somewhere and use one of those, outside phones. Whereas I've obviously now we've got FaceTime.
Yeah.
Now we've got WhatsApp. Now we've got AI. So technology has changed so rapidly in the last 30 years that there's so much that can be done. I remember being a child and my mum receiving telegrams
Yeah.
From my granddad in Ghana.
Okay.
And it's, things are so different now.
Yeah.
And with that development,
Yeah.
there is more, as you said, there's more that can be done. And we know so much. So it's very hard to know that a particular operation is going to do so much good, but it's only restricted to one country or one part of the world. And then that there are other people in a different part of the world that would benefit from that surgery or that knowledge, and it
Yeah.
would change their lives.
Yeah.
And it's very hard not to feel the need to share that knowledge. For example, research. There's many, many, many units that would benefit from research, governance, good data collection, and not having that, it's kind of like, well, we need to do that because globally we need to improve mortality in different areas. Maternal mortality in sub-Saharan Africa, many countries, is still quite poor. So definitely there's a need to improve postpartum hemorrhage. Definitely there's a need to improve hypertensive disorders of pregnancy. So if going and doing an outreach means that learning and those techniques are shared, then it's something that it's very hard not to do that. And there are many global organizations and charities that aim to do that. So if the individual, on the individual level, if the individual doctor also feels the need to do that, then it can't really be criticized so much, right?
No, no, I
Yeah.
agree. Yeah, I mean, and those are the things, that are taking center stage now in the diasporan health um issues. But one thing that I want to also lay bare is that, like you mentioned, there are different things that sometimes drive things, things, kids school, the kind of healthcare yourself you get whilst you are abroad or in the country sometimes affects people. Yeah. Sometimes you think, oh, if I went to Ghana, for example, and I needed a particular help for myself or my family, it's not readily available as we speak now. So that sometimes deter people. But the turnaround is that the more or most of us go home, the more that health situation gets better. You understand? So yes, it might not benefit us now, but the long term goal is that it helps the next person.
Yeah.
So here we are.
It's about, remember, when we started this, we said that, we want to talk about how to get good health, how to keep it, how to share it.
Yeah.
And that's the point. It's about everyone gaining that health wherever they are, you
Yeah.
know, sharing that within our communities. And I think it's like when something has to change. It starts with one person, then it goes to the next. It's like a domino, it goes with the next one and the next one and the next one. And hopefully with the numbers increasing, then that affects change. And so what do you think then of then in the future? Because you know that in the next 20, 30 years, the population of African countries will be mainly young people.
It's a good thing, isn't it? Young, more energy, more ideas, will be able to do more. People keep saying that the future is Africa, and I agree to a large extent. We would go through the cycle like every other country. We'll go through a period of very, very young um, population. We'll do things, we'll industrialize, we'll do amazing things, and people will start growing very old and not dying. So it's a cycle that I think we're also going to go through. At this minute, we die very early. Things that shouldn't kill people are killing people: hypertension, diabetes, whatnot, because we just don't have what it takes. But I think it's all coming together, and it will come together. So we'll go through the same cycle, but hopefully we'll learn from what we know, and then find ways. In 2018, I attended a conference about aging in France, and I was amazed by how much money is being put to 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 allow people to age and not to die. So I mean, those are things that I think we can take cues from, and use them to our advantage.
Yeah,
So yeah,
there's a lot of work in longevity medicine right now.
right.
and lifestyle medicine and social prescribing. And I think that, those are really valuable investments for the future, because if a lot of the conditions can be prevented, then you're saving a hell of a lot of money
100%.
in medications, in the need for healthcare
Yeah.
providers
Yep.
by optimizing health, right?
Yep. Yep.
So there are definitely areas that need to be invested in.
Yeah. And I think Africa will do. Yeah, I don't think I have any doubt in my mind that we'll do that, as people and as diasporans. I think we would.
Are there any countries that you think are already leading the way? If you look at the various nations, you're going to say that there's more progress in South Africa or in East Africa or or it's still very much the individual level.
No, there's progress. South Africa, it's sometimes we put them out of the equation because I think they had a very long time of European occupancy and all of that. But as we speak, young countries like Rwanda is taking very massive strikes, and they are doing it for the people. I mean, when I visited the place, like you can tell it's a very very young country, and they are getting it right. Yeah, it's not just throwing money at things, but they are getting it right. I was amazed to find that every 2 weeks, the people in the city gather at a particular location. They do physical activities, physical exercises. Government leaders and things like that also are part of it, which is great. I was amazed to find that everybody was sitting on a motorbike had a helmet, whether you're a passenger, you were a driver.
Wow.
Everybody. There was not a single person who didn't. I swear,
Yeah.
I swear on anything that I know, not a single person was on a bike without helmet. So getting the basics is very important. And then when you go to their health sector, they had most of the things that you need, diagnostic, facilities were readily available, so the country is moving in the right direction. Um, Other countries that are visited in places like, Kenya and things, if you go to peripherals, you find that they also, again, they have, I don't want to talk about Ghana because, sometimes it hits me because I expect a lot from Ghana, but you find that the whole of Ghana, we might have like maybe 5 or at most 10 MRI machines, which is not great. Yeah. But if I compare that to other countries like Kenya, you find that there are many MRIs. You don't need to be in Accra or Nairobi to have an MRI imaging. You could be anywhere, some small village, and the next district will have an MRI machine there. Is it private? Is it government? I really don't care whether it's private or it's government, so long as it's there that people can get to it. Great. Yeah.
So if let's say a diasporan doctor wants to go back and, okay, they get their license, how do they get work? Do they start their own practices, or do they go and work with private clinics, or do they go and work with the national hospitals? How do they then integrate back into the system?
That's an excellent question, Jacqueline, because at the moment we don't have jobs being advertised to all and sundry. See what I mean? To the diasporans. But so it's a bit of networking here and there, who you know, who you don't know. Um, so that's why the private sector is sort of absorbing a lot of the diasporans. But by and large, most heads of hospitals, governments, quasi-government hospitals are again tapping into this, and they are poaching on expert and specialists. Those who want to open certain specific departments are poaching diasporan specialists to sort of to get the game going. So those are the things that are happening. Obviously, the Ministry of Health is there. If you want to apply to them, you can, especially if you have a license. But the key thing is that the licensing aspect has been sorted. So that makes it easier. Obviously, there's the academic side of things. If you want to go into teaching and go through that route, those are all still options, but it's not hard as we speak.
Very exciting.
Brilliant. Yeah, I'm excited.
It's very
Yeah,
exciting times
yeah,
indeed.
yeah, yeah. I am. Yeah,
But
100.
the other thing though is that with the balance, there needs to be a bit of stability. So I'm just going to throw this in. Okay. So, sometimes you hear people who are like building houses and they go and they buy their land and they, you know, and then they end up going and they're having, well, some issues with the land and who owns the land and that kind of thing. So if somebody has a job here and then they're thinking, I'm going to go and try something, what's the likelihood that they're going to do that? And then they're going to turn around and say, I'm not sure I like this. I actually want to come back. So, would it be, what would be the way? I would say something like maybe trying it out and see if you like it first before, taking the big jump.
Yeah, I mean, at the end of the day, I mean, what's our greatest fear and what's the worst that can happen? Yeah. Um, there's almost nothing that can take away the skills and then the expertise that you have away from you, unless, God forbid, the worst happens. Yeah. But if you start a business, for that matter, it doesn't make it. Does that stop you from starting the next one? No. Right? They say that, failing to try, there's a phrase
Yeah.
like that,
Well,
failing.
the business people say that you need to try, but you need to fail fast. So you need to try lots
Exactly.
and lots of little things. Try it,
Yes.
fail, learn from it, try, fails, and learn from it.
Yes. Yeah.
Eventually, your learning is going to help you to get that big business that is going to
Correct.
work.
Yeah. And it's all calculated risk, isn't it? But I think it's almost guaranteed that, it will not be the same. Yeah. And you might say that, okay, actually I want to go back, which will always somehow be there. Yeah. Or may not be there, especially with this prioritization business stuff. Yeah. So having an open mind, some flexibility is fine. But I think if you are good at the skill that you have mastered and then acquired, it shouldn't be a problem really. Um, I mean, I take personally, I'm I'm never scared to change places, you know, and I feel that. See, we traveled. You were not born here, isn't it? I wasn't born here either. I traveled all the way from Ghana to China. It's very far, yeah. And people have gone furthest, yeah. But the distance didn't stop me from going. The fact that I had zero idea about China didn't stop me from going, yeah. And the story is a success story, isn't it? So, if you put your heart to things, you put your hard work to it. You basically pray to God or pray to something, pray to Allah, pray to whatever the universe, whatever it is. But I believe that the system is set up for us to make it.
It's very, very interesting. I mean, I think I'm going to just explain the medical prioritization bill because says that essentially, in terms of the new jobs or the new doctors, the local doctors, the local graduates will have prioritization in terms of jobs, in terms of training jobs, right? And because of that, there are many doctors who have come to the UK hoping to get these posts, suddenly being in a situation where they're not easily going to get these posts. So
Yeah.
that has made a lot of people kind of rethink their plan.
Yep. Yeah, a lot, a lot. I tell you what, there's some young doctors in my unit, yeah, who are one has recently gotten a postgraduate training in China. He's going to do neurology in China, and this guy is from Malaysia or something like that. Yeah, there is another chap who's going back to India, for neurosurgery training. So everybody is realigning their
Yeah.
thoughts and their
Thinking
moves.
about
Yeah,
what else they can do.
thinking about what
Yeah.
else they can do, and that's human beings. Yeah, we are resilient. We improvise. We 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 shoot for the stars. Yeah, and nothing will stop us at it. At least that's how I like to see things. So yeah.
It's been a really interesting conversation, Mark. And it's a wonderful way to start Afro Health Diaries podcast series. And hopefully, over the next few months, we'll interview some really interesting guests. Obviously, just to say for those who are listening to us that this is no medical advice. This is really a little bit of friendly conversation about different issues in healthcare. And there's nothing in this that constitutes private medical advice or healthcare information. We always advocate that if you need any healthcare information with your own personal care, you consult your own doctor or healthcare provider. So this is intended purely for informational purposes only. Read our disclaimer for this as well, which spells things out clearly. But Mark, thank you very much for being a fabulous first guest and also the co-host of this podcast series. And the next one, you're going to be taking the mic, right?
I think you're very good at hosting.
Really? Mm.
Yeah.
We got to take
I
it
will,
in turns.
I will be supporting, but yeah, by all means, I'll be glad to be honest. It's
Brilliant.
been really good
It's been
one.
really nice talking. So,
Yeah, same
yeah,
here.
catch
Excellent.
you again.
Adios.
All right. Thank you. Bye.
Cheers. Bye.
Bye.